Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
After surviving a heart attack, most people do try to make some lifestyle changes. Healthier diet, more exercise, maybe getting some pounds off. But what about sex? If you've had a heart attack and forgot or were reluctant or hesitant to ask your doctor about intercourse, you're not alone.
So we're here to answer that question for you. That's what we do. Our guest today is Mayo Clinic cardiologist, Dr. Francisco Lopez-Jimenez. Dr. Lopez-Jimenez also serves as an editor for the Mayo Clinic Health Letter. Welcome back to the program. It's nice to see you again.
Thank you. Thank you for the invitation.
Dr. Lopez-Jimenez, it's so nice to have you back. I guess if you've had a heart attack and you're leaving the hospital, sexual activity is probably not high on your list of things to talk to your doctor about?
That's actually very common. It's a very common concern that patients generally don't talk to the doctors. But most people will think about it in one way or another, but they just don't talk about it.
Do they figure that they'll just see how it goes, or that maybe they'll talk about it at a follow-up appointment? Have you ever gotten that far into the weeds?
Yeah, probably some patients just don't see that as a relevant or important thing at that point in their lives. But others might feel afraid to talk about this. Maybe they probably don't want to be perceived as focusing the wrong things. I don't know. But it's actually very common that we, the cardiologists, have to bring it up rather than the patients asking about it.
Do you generally make it a point to bring it up?
Yes. If the patients don't say anything about it, I basically ask them, would you like to talk about your sexual life? And more often than not, they will say yes, absolutely. Yeah.
So how physically taxing is intercourse?
It all depends. And it is different from women and men. And also, I mean, it's a range. But generally speaking, it will be about going upstairs at a slow pace, a light jogging.
How many flights?
Good point. Well, as long as the duration of the activity. So
it's as taxing as walking upstairs.
It is It is similar at a slow pace.
Slow pace.
Yeah, slow pace, which is about the same as a mild jogging. But again, it depends, men and women, and some people might exercise more strenuous activity during sexual activity.
So do you also bring up exercise when you're having these appointments? I mean, if you're going to equate that to walking upstairs or light jogging, I would assume that this falls very easily into something that you bring up with patients.
Yes, absolutely. We talk about exercise and other issues about lifestyle, stress management, taking the medications on time, etc. But so this is generally part of the general recommendations. But we also want to be sure that the patients understand the fact that in most cases, sexual activity is okay after a heart attack, after taking some specific precautions. And in some cases, it might not be okay. They may have to wait because the condition might be serious enough that they just cannot do that, at least for some time.
Specific precautions?
Yes. Generally speaking, we recommend patients to go to cardiac rehabilitation after the heart attack, and that applies to everybody. And that's a good way for patients to go back to their normal life. So they get confidence exercising, and they get confidence performing the day-to-day activities. The second thing is to do an exercise stress test. We want to be sure that when they exercise, the heart is okay. And third, we also want to be sure that they know that the combination of some medications like nitrates or nitroglycerin don't go very well with some medications used to increase the sexual performance in men.
So the nitrates, why do people take nitrates? Nitroglycerin.
That's given generally to open up the arteries of the heart, the coronary arteries. It's also given to treat patients with chest pain after a heart attack. So those medications dilate the arteries, open up the arteries. And what happens is that the medications used like Viagra or medications for sexual performance, they generally have a very similar effect.
So you shouldn't use the two together?
Not at all, because the combination might actually drop the blood pressure a lot.
So do you tell patients basically to avoid sex until they have had a stress test?
Generally speaking, yes. And we also give recommendations to avoid stressful situations. It's well known that heart attacks after sex generally occur under very unique circumstances, like extramarital sex or sex in situations that are unusual.
How often do you actually see someone have a heart attack during sexual activity?
Yeah, it is uncommon. It is actually very rare, but when that happens, generally happens under those circumstances that I mentioned. Usually with extramarital affairs or in unusual situations of thrill and danger.
You said that the patient, after they've had a heart attack, they have to do cardiac rehab, and that you suggest they do not have sex right at the beginning of that cardiac rehab time. How long is the patient usually in a cardiac rehab program?
Well, it's usually between a month to 3 months. It's a time. Actually, they don't have to wait for the 3 months to do it. Mm-hmm. When they are attending rehabilitation, they will be exercising every time they go to rehab. So at any time, if they can prove that they can be on the treadmill, performing a physical activity that will be at the same level in terms of effort, they will be okay.
And what do you tell them about alcohol? Because often the two somewhat go together, at least for some people, alcohol and sexual activity. What do you tell them?
Well, to drink alcohol with moderation, and particularly to prevent the dangerous trio. The dangerous trio is taking a Viagra pill, taking a hot tub, and then drinking alcohol. Because the three of them will actually cause the same effect as the nitrates. So they may actually have a big drop in the blood pressure.
But the cardiac rehab is certainly key, not only in improving your physical activity after a heart attack, but also allowing you to pass the stress test so that you can give them the okay.
Absolutely, yes. And also we recommend patients to, if they develop erectile dysfunction after the heart attack, it is generally caused by some trauma or some unrealistic fears. So it's something that has to be discussed because many patients develop depression after a heart attack. And part of it is actually the fact that they really feel that their ability to do normal activities has diminished. And many times it's just a matter of reassuring them that they can actually do it. And one of those key things is, of course, sexual activity for those who are sexually active.
All right. Well, if you've had a heart attack and wonder if it's okay to resume sexual activity and you haven't talked to your doctor about it, well, now you know. And interesting, avoid the dangerous trio: Viagra, hot tub, and alcohol. Thanks to Dr. Francisco Lopez-Jimenez. Enjoyed having you on the program. Thank you.
Thank you. Thank you for having me here.